Hi everyone, this is Dr. Chris from FIMIA. Obviously this is not the usual way I start off the podcast, but I wanted to let you know and also apologize about a rather large technical issue that we had during the recording of this podcast. My workhorse computer of 9 long years took its last breath, unfortunately right at the end of the recording of this podcast, so in the last 5 minutes you will notice a drastic reduction in the quality of recording. Luckily I had cameras recording, so I was able to lift the audio from them, but it's not as good a quality as the rest of it. So I do apologize, but it was too good just to leave off because the content has Ivan McWilliams and also Martin McKenzie, my guests for this episode, speaking about the release of their the book that they've been working on for the past 10 years, Tui Na, an Integrative approach. So once again, I do apologize for the drop in quality, but still the content is amazing and very worthwhile listening to. So I'll get on to the podcast now. I just wanted to remind you that Kickstart Your Clinic, the Acupuncturist Essential Guide to Setting Up Business, will be released soon. That's on the 12th of July. So watch out for that. That's coming soon. If you are interested in more podcasts and all things acupuncture related articles and CPD courses online, please go to FIMIA.com.au. So now I'll leave you with the podcast. Ivan McWilliams and Martin McKenzie. I hope you enjoy. This is Dr. Chris Ferris, registered acupuncturist, and welcome to FIMIAcast, the official podcast for the Parisian Institute of Modern Integrated Acupuncture. If you are an acupuncture practitioner or student, or you have an interest in acupuncture, then make sure you go to FIMIA.com.au and sign up for free to get notifications on our latest courses and resources. My guests on FIMIAcast for this episode are Martin McKenzie and Ivan McWilliams, Chinese medicine practitioners in Australia with a passion for Tui Na massage. After studying Oriental medicine and practices such as qigong and shiatsu, Martin found himself as a student to Ivan in an 8-month apprenticeship where he learned firsthand the clinical application of Tui Na. Since then, the pair have remained close, and after almost a decade of gathering techniques, case studies, treatment approaches and protocols, they are now on the home stretch of completing their collaborative effort, Tui Na, an Integrative approach, a comprehensive guide and resource for students and practitioners. Well-travelled and brimming with experience, they have both played a substantial role in the development of Tui Na as we know it in Australia today, as educators and teachers of manual therapies and Chinese medicine. Martin was one of my lecturers in both Tui Na and acupuncture throughout my degree, and I also had the good fortune of briefly meeting Ivan along the way. So it was an honour having two such highly influential individuals of Chinese medicine in Australia in the studio to find out their stories.
Thuggish acupuncturist, twinologist. No,
What is it? Twinologist? Did you
twinologist is what I say.
Ah.
Yeah.
Because it piques interest. It's not a term that's used.
Yeah.
No, but when I came back, someone said, "What do you do?" I said, "Twinology."
Twinology, I like that.
And said, "Is that the term?" And I said, "No, I think it's tween a practitioner, but twinology denotes what it is."
Yeah. Ology is the study of, or the
Study of Tui Na.
Yeah.
I'm a twinologist.
And all of a sudden it becomes more legitimate because you've given it an ology.
Twinologist.
So I quite like that one. Confuses people,
Yeah.
you know.
Yeah.
A lot of them it's still tuna. You do that tuna stuff? I said, no, we don't use tuna.
Yeah.
Salmon. But yeah.
Whatever's in season and ethically caught.
I've had a few say tuna.
Yeah, I hear that with students when they're first starting off. It's tuna.
Yeah. They miss the I.
Yeah. Well, it's a privilege and a huge honour to have you both along today on FIMIAcast.
You say that now.
I do say that now. We'll see how it turns out. Martin McKenzie and Ivan McWilliams, thank you so much for coming along.
Thank you.
Yeah.
Thank you.
So, what's been happening?
You tell them your life first.
A whole lot of
Hang on.
twinology.
How far are we going back?
Let's start with
This morning?
I want to go further back than that. We do have a whole hour.
Mm.
Hang on, there's two of us.
Well, okay, half hour each. All right, very condensed.
Either that or we have to speak twice as fast.
Yeah, we can do that too. We can speed it up in post.
Oh my gosh.
Okay, so for myself as a student of both of you, very briefly of yours in one session actually, when you filled in for Martin.
Oh, nice.
Yeah, and you of course, who were you were a lecturer of mine throughout my whole degree, so a big influence on my life as a practitioner and a lot of other students as well. What was it that brought you to Chinese medicine, Tui Na, acupuncture?
I'll try and keep it brief, which for me is really difficult. Darkest period of my life, a friend introduced me to qigong. Qigong brought about immediate benefits. Through a whole other series of circumstances, I was long-term unemployed, but really riding the system. So I'd drop in and off the dole, and I'd get enough work to make sure that I wasn't always on the dole. And then when I was just about to flip off the dole, I'd leave work and do all those sorts of things. So pretty directionless. And I had a case manager because I was classified long-term unemployed, even though I sort of was but wasn't. I'd just been on the system. And she asked about my star sign and a whole bunch of other stuff. She was a bit of a hippie. And then she said, is there anything else that you're interested in? At that point in time, I was actually training to become a qigong instructor and Tai Chi instructor, but my focus was in qigong. And I said that I was curious about massage, and she said, well, if I think you'd be good at that because of your star sign, literally, I'll buy you the time if you can find the money to go do it. So I did.
Yep.
And it started out as that. So I first studied shiatsu, had a bunch of really unusual things happen during class and during practice.
Such as?
Just weird things happening with my hands and stuff.
Yeah.
So I had a whole bunch of questions. Figured that I kind of got the bug for doing stuff with my hands.
So when you say for people listening and for novices of qigong and the arts such as that, what is it the strange things happening with your hands? The feeling, is it a
feeling, sensations? I don't know. Like things that happen in my head, I'd see things. And I think I was in a really interesting state of not trying to work things out or not actually understanding what the hell was going on. So a lot could happen. So I hadn't put up those sort of mental roadblocks that we tend to do when we overthink. And I'm really good at overthinking. So had a whole bunch of questions, decided that I was probably going to pursue shiatsu further, but had a good look around at other courses and found Tui Na. That was it. So I rang him on a Wednesday. I remember that. You couldn't pick up. You said, I'll ring you back on the Saturday. And then I think I had 3 questions. We talked for 40 minutes and I hung up. And just before I hung up, I said, I'll see you in July. I think that's when the course started.
Something like that.
Yeah. So we went through July for 4 months through to whatever 4 months is after July.
November, I think we finished. By the time we spread it out.
Yeah.
That was the little course I ran over at Kensington.
It was
you came into the early one at Sahek. That was a short one for him.
Yep.
So yeah, that's where I met Martin.
So I did the full-blown Tui Na course down in Adelaide, and I did everything backwards. So Tui Na was an elective out of the diploma, but it didn't have any prerequisites, so they couldn't say no.
Yeah, okay.
So I'd done shiatsu somewhere else and went and did 4 electives, which people normally do late in their studies. And then I went and did like a clinical apprenticeship with Ivan. I sat in with him in his rooms for, 8 months?
Yeah.
About there.
Yeah.
And then I went back and did the rest of my studies. So I went and did, your therapeutic, your sports, your remedial, myofascial, and all the other subjects.
Yeah.
So I kind of did everything upside down and back to front.
Yeah.
Which was good.
Yeah, well, I guess you get all the clinical experience first.
Yeah, that was excellent. So I actually saw how things could be put into practice. And Ivan works with Tui Na and acupuncture, so I saw the two of them put together very, very early. So that really shaped how I wanted to do things. And as it was towards the end of me sitting in with Ivan, he said, "I'm about to kick you out soon, so what are you going to go do?" And I went, "I'd like to study acupuncture." He went, "Good idea." I said, "Yeah, but I'm going to go do the rest of my massage studies first." He went, "Even better idea." So for the next 2 years after that, I think, it was basically, I just took anything and everything I could. So I was working 7 days a week, studying and work about 7 days a week.
Yeah.
And then moved up here to do acupuncture.
Yep. Yeah. And then so you had already been teaching and practicing Tui Na for some time before Martin came along?
Yes, I did before that. So I think I started teaching at SAHEC probably 94, around that period. I was teaching sports massage. When I started, I wanted to be a naturopath.
Yep.
So similar thing. Went through a dark period. Probably not the finest part of my life, but
seems to be the
I think
the
everybody's
thing for us
got,
all, doesn't it?
Yeah, I think some people you get to make that decision. I used to call them holy moments. You drop to your knee, hold your sword, and make a decision whether you want to go that way or that way.
I like that.
And I got forced into a corner through sickness and also what I was doing at the time. And someone just said, "Look, you were in your martial arts school. You're always fixing people. Why don't you do it for a living?" So, I'm not sure you can make a living out of that. But I always wanted to be a sorcerer, so I thought, nutrition would be good. So I looked into a naturopathic course, and I went and saw a guy named David Lomman, who was head of the Complementary Medicine Association when it existed. And I said, "Where can I get a good course for the cheapest price?" Because it was expensive and wasn't a lot of choices in Adelaide. So he gave me a couple of courses to do online that were acceptable. And then he said, "Well, why don't you go do some body work as well, do sports massage? Always a good backup for a naturopath to do body work." Yeah, all right. So I went to SAHEC and learnt there. And then I started teaching that after I got that. And then I moved into a premises, and there was a guy taught a little 1 year course on Chinese medicine and Jin Shin Do acupressure. So he kept nagging me to do it. "No, naturopath, going this way." There was a lull in my studies, a couple of weeks. So I thought I'll go do some pressure points.
Yep.
And I loved the Chinese concept, because he was teaching the theory of Chinese medicine, 5-element, and the pressure points. And then I started putting them in on top of the normal sports massage, and came up with this amazing new therapy that no one's ever thought of. Maybe 2,000 or 3,000 years late, but still, it was new to me. So I was getting better results, and then I finished that. And that's pretty well where it was going to stop. But I got an invitation to go to China through a guy running in New South Wales. Must have been looked at me up on the site somewhere. And 2 seats left. Do you want to come to China, Lewis Tui Na? What's that? And I've been pretty good in my life of going and doing something that looks interesting. Martial arts, the same thing. What's that? Rather than what was, karate. That was common.
Yes.
But this wasn't.
Yes.
And I'd never heard of Tui Na. So I did. So I went over to China and saw what I wanted and went, I got to make that better. So I just came back with like 50 books and started experimenting on my patients. And I just got better and better at it. I literally just added more from what I'd learnt. And then, then I was asked would I run a little workshop And I did, and it filled up, and I loved it. And then I wrote the diploma course, got that accredited. And then it was just 12 years of teaching that, and in between shot off and learnt acupuncture as well. And another invitation, it wasn't for me, it was actually sent to the doctor next door.
Oh, really?
And someone put it in my room. I thought, I'll go to that. So I turned up at Brisbane to this 1 week introduction to acupuncture, and saw all these doctors in there, and I thought, whoops, the wrong place. Told him. He said, that was supposed to go to the doctor next door. I said, I didn't look. I just thought that looks interesting.
Yeah.
And asked, could I go study with him? He said, yeah. 6 weeks later, I went to Sri Lanka.
Yeah, wow.
And then, it's not been a really great plan. It's not like something I woke up one morning.
Yeah.
Chinese medicine's the thing for me.
It's always the best plan, isn't it?
It was great.
Yeah.
And Tui Na became such a big part because I got good results. And I started looking at it very, very different. Because I like to understand where things come from, even if it's not necessarily what you want to do now. And Tui Na, there was bits forgotten. Everybody put it down to just sports and fixing injuries, and it's a massively big part, but there's a whole bunch of other stuff. So
I mean, treating like
emotional
gastrointestinal,
disorder. Yeah, migraines and kids' diseases. And when I saw that in China, so acupuncture without needles. So when I wrote the course, I threw in as much as I could, including the emotional stuff and Chinazan. And
you shoehorned everything in there.
I packed everything in the classes that come in with this is how the class will run. Nope.
Yeah.
That's how we'll get through that, and I will add as much as I can in the time I have you to influence your life.
Yeah.
So that you'll be intrigued by it, rather than, I think 5 of my students in the first class were just doing as an elective to fill in time. 2 went off and got acupuncture degrees.
Yeah.
So they just said, I only came in for 2 classes and I got them.
Yeah. I had that one brief meeting with you in that lecture. At the time, you were quite a... The name was like quite revered around endeavours. Like, Ivan's teaching the class. I remember you walking in, and I think we were all a bit intimidated.
Yeah, I heard that.
Yeah, and then, but then you started talking. I'm like, this guy's a teddy bear. He's so nice. And then, but even that, you would demonstrate a few massage skills, and one particular one with me you pressed somewhere here and then up here, and then you stuck your finger in my up into my liver, and it was very interesting. And then, but you were able to discern things from those brief moments where you laid your hands on me and the other students, and you were able to tell us stuff that you couldn't possibly know without us, Yeah.
It's interesting that the body, and that's what we've written in our, the book we've come up with, is in the past, that's what they did. Half the diagnosis wasn't the question, it was what they felt, saw, and had learnt to decipher. That's the pulsing in acupuncture and everything. But pulsing I added to the Tui Na.
Okay.
Because it wasn't taught where I was.
Yeah.
You got all the other stuff, but they didn't do much of the pulsing.
In China, they won't do pulsing with acupuncture.
Really?
Nope.
No.
It's for herbs?
Yep, that's it.
Yeah, the degree that's taught here is a bit of a amalgamation of things, isn't it? It's based, like, our acupuncture degree is based on herbal medicine.
Well, the diagnosis part of it is,
Yeah.
8 principal patterns is
Yes.
a herbal method of diagnosis. And you get exposed to other things along the way. So you'll get exposed to Dr. Tan or tongue, actually not tongue, because that's too complex. But you'll get exposed to Dr. Tan and other methods or other systems, but principally we're taught to think as 8 principal pattern practitioners.
Yeah. And is that, from your experience, having been to China, is that...
In China, they'll do whatever.
Okay.
We sat in with the doctor and we were looking at the points he was using for a lower back, And there were a couple of randoms in there. And we just said, well, what are those points? And the doctor didn't want to answer us at that point in time. So we just kept pestering him. So like, what are those points? What are they for? And the answer finally came back, it's time-related acupuncture. So he would start his treatments off by doing the points that are appropriate at that point in time.
Yep.
And Matt, one of the guys that was in the group, pulled out his little phone and just said, which system? Because I think there's about 6 different systems. Now, the doctor had a big desk with all of the charts there under glass.
Okay.
So he'd look it up for the day and then have it in his head, right, it's this day, these points. And I think we were kind of... China can be a bit of a grind. It's an amazing experience, but it can also be a bit of a grind as a white person. And Matt looked that up and just said, tell him he's wrong. I said, what do you mean? He said, it's the wrong points for the day. And that didn't go down well at all. That really wasn't the right thing to say. But that just exposed us to people would use all sorts of different treatments.
Yes.
There was a guy that he called it fire and water. So he would use point injection therapy along with fire needles. Mm-hmm. And it was one of the most confronting things I've ever seen. So he would be, 6-inch needles through the back into the uterus and heavy stimulation to induce cramps to treat fibroids. It was brutal. Now, we can't practice like that here.
Why not?
Gee, I wonder why. But it does expose you to the broad...
Absolute variety.
The possibilities of treatments that are available and can be done. Yeah. It can also show you that you can do fairly adventurous things, I'll say, with... Yeah, actually, I don't know what the injury rate was there. But it just exposed you to a whole bunch of stuff. So that kind of taught me to be unscared about deep needling in certain areas. I mean, you can't be stupid. But it did show me what could be done and what was done regularly with probably little detriment to the patient apart from pain. Yeah, it was interesting.
I found that using the Tui Na, I don't need to do that. I can keep the needling shallower, less invasive, because I'm not relying on the acupuncture to do all the work.
Yes.
So the Tui Na would, some of it's very uncomfortable, but it's all within the patient's acceptance level. So we stay within that, and that also gives me other things. People would ask, I can feel that somewhere else. That's a trigger point.
Yeah.
But some didn't add up to trigger points either.
Okay.
So there's inflammatory points, or whatever you want to call them, shoot points. So I learned a diagnosis to go with it, because when you're touching people, pressing the gut or in their arm or something, you would get sensations that I could understand how the Taoists understood. This is qi moving, an explanation for the feel. Mm-hmm. The little section we got on demon hunting.
It's not little.
My son is, and rightly, he rolled his eyes a little bit. Demons.
Yeah.
And I said, well, that was the term used, because they couldn't understand why a person had altered their mood, the way they didn't get well. Back then, many cultures thought you were invaded by demons.
Yes.
We've just got different names for PTSD, generalized anxiety, infection, low-grade infections. But they did come up with treatment plans, and Tui Na got somewhere shrunk that it was just a musculoskeletal medicine. Yeah. And it wasn't originally. It was probably the one thing everybody could do. You could teach that to the village healer would use more, bone setters, putting the bone back together and understanding that we carry stress and there were points that you could hold, touch, and interpret, and then almost look mystical on some days, because it's just the body telling you what's wrong, and you're looking for it. And Western doctors used to do it.
Yeah.
You know, look down your throat, what's the colour of your skin, poke every part of your body, where it was sore, and
Poke you in the
diagnose
belly.
you that way. But
Like, even when I was a kid and I went to the doctor, he used to lay me down. Didn't matter what I was there for.
Yeah.
checked you everywhere.
Poke your belly, percuss your back.
Yeah, do all that, check this out, make sure. And then somewhere along the line, technology interfered, and we're more reliant on that.
Yeah.
So, but with Tui Na, or any tactile art, no matter what it is, you learn about the person because you get to feel the person.
Yes.
You know, if you touch someone that you know is upset, but you ask them, how are you doing? I'm fine. But you shake their hand or give them a hug, and you know there's something wrong.
Yes.
Because you felt that yourself. You're scared, you're angry, or whatever. And the therapist feels that as well. It's just that they keep shutting it off. You know, and nobody shut it off for me.
Yeah, okay.
Nobody interrupted it and said, oh, no, that's just a muscle tight. He didn't. He'd tell me that's anger. And I go, is that what it feels like? He said, inside, yeah. On the outside, he looks calm.
Yeah, I see.
But that's anger on the inside.
Yeah.
It's really tight, constrictive, and sinewy. And then he taught me how to press on an artery and feel the tension in the artery. And I can feel anything. He said, oh, very person in a lot of grief. What? I just hear boom, boom, boom. But I guess like a safe cracker, eventually your fingertips get really, really and your mind stays open. And what I tried to teach was to get the students to keep their minds open, like keep shutting it down to all the information coming, including the sounds the patient made when you pressed them, the way they presented it, the look on their face. I've got to say, with Tui Na, there's always some looks.
Yeah, there sure is.
Some of them don't look good. It's like, you know, I may have to leave. But yeah, you can get a lot of information about a person and then relay it to them, and a lot of it's pretty accurate, enough to give a person an idea that, you know, this may have benefit for them.
Have you had any experiences throughout your years of treating that have been quite bizarre? Any like anything you'd like to share? Any
Well, some of them I've kept quiet for years, because honestly you would start to think I'm either loony or the patient is loony, but they're not. It's the way the person reacts to what's happening. I mean, people have definitely had, if they're being counselled with someone and they hit on a touchy subject, there's definitely a physical reaction and a reaction, and these can be good or bad. But I've had a couple where I think I had to think about things a lot. You know, like what just happened? And one of them was a psychiatrist I was actually treating, and they had a lot of childhood issues, which they knew about. But the person said, I'm really good at sabotaging the healing because I know what to do. I need somebody to approach it from a point of view I can't test it. And I said, well, okay, we'll go real old school. Yeah. So basically it was, you know, someone called an exorcism, but it's not. What we did was a series of treatments that I'd learnt. One was the 7 Dragons treatment, or the series of points was supposed to help with deep emotional stuff, so I used that. And then there was a mixture of some other rituals that were done not just in China but from her culture. I found out where she came from. She was Celtic, so I found some old Celtic things that would probably stimulate her mind to step get out of the way of interfering constantly. And so she was intrigued when I do the treatments that I would say things. Say there was one a prayer in Gaelic. I went and learnt it, and whether I got the pronunciation right or not, it just intrigued her. It was odd, but it worked because she couldn't get in the way of it. She just kept being intrigued by the process. But the actual treatments were not a standard treatment, but they're a set treatment to help people with deep, unresolved rage. And she had a lot of rage. But she wouldn't let it out. So you just got to find a different method. Some people go off and do qigong and it'll help, and other people go off to an ashram. Others will go sit in the mountains. Some will join a religion. Some they'll find something to help release that. And
or not.
Yeah.
In which case it stays on board.
And it just gets repeated over and over again. It goes through the same concept, same back pain, never goes away. And the damage isn't good enough. Look at the X-rays show you're quite fine. But there's pain. Migraines that never stop. They're not all based on that, but there's a big chunk.
They keep
integrated,
playing the same program over and over again.
And get stuck.
And is the result of it. So it sounds like to me, in my experience, I've done Tai Chi and Qigong, and also I don't know if you've heard of it's called vibrant celestial meditation. It might be it's you get yourself to a point where you let go and you allow what some people call the great spirit, or your subconscious, whatever you want to call, and you stop thinking, and this thing acts through you, and you laugh hysterically. You go into the most amazing ecstatic experience that you can do without taking any form of stimulant. But there's a point where it's like you switch off. Is it something like that this woman experienced in the treatments? She
gave into it. It confused. Well, I wouldn't say it confused her, but it didn't fit her model. She couldn't control that part. And there was a philosopher, Alan Watts, said once, the only way to get sane is to go out of your mind. And from that point, he meant that sometimes people going insane is their mind having a rest. They're stepping away from the life they have right out. The trouble is you can't go too far. So sometimes you have to step out of yourself and free yourself to let it out, and then come back and observe your behaviour. And hence, he mentioned also hysterical laughter and people doing the most bizarre physical gyrations of letting go. And this woman had one of those. And it was just odd to watch because she was freezing cold one minute, she chattering. And then hot. And then her back would bend like something was trying to climb out of her.
Wow.
And I guess my second apprentice was in the room with her partner, and they're all, and I'm going, this happens sometimes. That was the way her body was expressing everything she put inside it. She controlled. It had twisted her up.
And you can see how that would be, in older times, that's an exorcism. That's,
they would have said
demonic possession of
something left.
And
they thought it was a demon. Now we know that people go through physical changes when they release tension, and depending on how much you've been pumping in there and how well you've controlled it or manipulated it will decide how you feel. And what symptoms and possibly what illness you develop throughout time. And how much that has an influence over illness.
And if you open up the floodgates.
Gets floody.
Gets floody. Did you experience any of this when you were the apprentice?
Something like that, maybe not quite like that, but I remember there was a friend of mine that I brought in. Do you remember that?
I do.
Go on. Something similar?
Kind of, but it was more of an introduction. I think the purpose of the day was to show me what was a potential as far as these things go. So, Ivan got me. He started and was working on the abdomen and got me to stand next to him, hold my hand out over the top, and then I don't remember exactly what went on after that.
I think I remember this story.
Then he said, "Now tell me what you feel," and I just burst out crying. I just lost it. So, and it wasn't mine, but it took me a long time to work that out.
Yeah.
So whatever had been contained within my friend who was on the table at the day had been released, and I felt it.
Yeah.
So I think that was a moment where it was like, oh, so these things can happen as well. So it's not just about, I don't know, it's another area of treatment and possibilities.
You know, quantum physics, which is basically energy and energy transfers. The argument comes, can humans actually really define that? But considering I've met people who've got such a good touch, they can tell you the size of a lump in the skin, and I've spoken and met surgeons with such skill that they can remove things with hardly any damage.
Yeah.
You've got to think that there's different levels of perception. And it happens in everyday life where people can feel the pain in a family member or someone they love, and that transfers to them. We call it depression, whatever you want to call it afterwards, but it affects you. We're not isolated from it. And then we put it down to it's just psychology. Well, in most cases, what isn't? But if you can get near someone who's going through something horrid and you touch them, something transfers to you, whether it's the vibration of their body and their tension or the feeling or the empathy that you have for them. Either way, you don't get to walk away scot-free. A couple of the tuinologists, if you want to call it, doctors in China, had that effect on people. Just touching them, you could see the whole body just drop.
Yeah, really.
And you go, well, he's just got a beautiful touch. He could make a person who's very upset and a lot of pain, just touch them. But he never touched them in the same spot twice. So it wasn't like, oh, just put your hand on their shoulder, they'll feel comfortable, which is, you know, it's a common thing with us. But no, he'd work it out before they even did an examination. He'd be sitting there talking to them, looking in their eyes. The next minute you reach over and a different point on their arm, or he'll go, just put his hand in the middle of their lower back or in the middle of the back, and that's where all the pain is. And I said, you know, it was there. Yeah. Has to be. So, but they would just, I wouldn't say melt, but they definitely, there was a change in posture and everything. Immediately he touched them. Me, I'd touch him, they'd go a bit tight. Who's this guy? But I was touching him from the point of view, you know, that's a muscle, that's some bone. Yeah. He, in the end, was touching a person from a person's point of view who had pain and muscle and bone. And he'd been there long enough that even sitting with him was, you know, I'd calm down just sitting with him because he didn't know how to do anything but be really relaxed in life.
Yeah, and that was the influence, just being around them.
Yeah. They just had a manner.
You probably saw something similar in Sri Lanka.
Yeah. I saw a few there, and Anton had the same gift. He could just sit there and give him a big smile, and they'd feel very comfortable with him, and his doctor, the people he trained were the same. You know, it's just that happens with anyone. If you feel really comfortable, then you'll either let your guard down and let things out, but you allow the person. You know, if you find you have to have surgery and you find a surgeon you just feel so comfortable with. Yes. Yeah. They know that there's less bleeding, less anaesthetic necessary. They come out of it with a better positive. And that's all simply from your point of view that I like. You don't know this person much. It's just the way they present themselves. One of my ex-students ended up with a brain tumour. And it was a really good surgeon that lady was going to go see, and I just said off the top of my head, I said, my hero's Charlie T.A. Why don't you ring him up? And he said, well, that's, what do you think? I said, well, if nothing, he'll either tell you that you've got one of the best surgeons. Yeah. And then Charlie took him on.
Mm.
And they were talking 90%, which is pretty good removal. Charlie got 100%.
Yeah.
But he said when he sat with him, it was like, you can cut me up. You can do it.
Yeah.
He said he just made me feel so... He informed me of everything. He said, but sitting with him had that moment where all that fear and tension, he said, literally melted by the end of the session with him.
Yeah.
And that I was sort of excited to have this man see if he could help me.
Yeah, it certainly does, in my brief experience compared to your treating careers. You definitely notice a difference of people that you resonate better with, and how that affects the treatment outcome, and how more likely they are to come back to see you as well. And yeah, you're right. There's just those people that you walk into the room and just you get that feeling of everything's going to be okay.
It's the vibe, man.
Yeah, and taking the pulse. That first touch, the person taking this gentle reading, and you trying to work out what he's trying to do, whether you believe that they can do it or not.
Yeah.
It's for the physician. That's what he's learned. That gives him an idea what he wants. But that's also your first tactile contact.
Yeah.
And the thing about Tui Na that I've liked is that there's a tactile contact. You have a big effect on a human body, not counting that there's very specific treatments. And then using that with acupuncture, I've found I get really good results marrying the two together. So it's suited me.
Yeah, that the interaction of touch certainly does make a big difference. It's probably what I suppose a lot of the interaction with doctors is missing now.
Yeah, I think they're trying to go back to that. A lot of new doctors want to go back to actually the old-fashioned way of talking, touching, checking. So I think the approach we went with, we've gone over the years with Tui Na is how do you integrate it back into where it's not just simply fix a knee, that you're always got a person at the other end with a whole multitude of issues that may be influencing why something physical doesn't mend. And when I saw the complexity of Tui Na in China, that they treated pretty well 90% of all children's disorders from right down to measles, that it wasn't just for structure, it was for influence immunity, influence your state of mind, your spirit, helping someone get better on a holistic approach. And I think that's what I liked. It fitted into the 5 element that I learned.
With your practice now, Martin, do you use a lot of Tui Na?
Primarily.
Yeah. And because you obviously the main lecturer for Tui Na at Endeavour.
Oh, I'm one of them.
One of them?
Yeah.
Been there the longest, perhaps?
Out of this little bunch, yeah.
Yeah. So primarily Tui Na. Do you treat a wide range of conditions? It's like, what's your...
If I can, yeah.
Yeah.
But I'm not a business person, so I've never really marketed myself very well on that front. I stepped into a clinic where a practitioner was moving away to do further studies. So the existing massage and acupuncturist was going on to do a postgrad in physiotherapy. So basically it was an issue of me stepping into his shoes. So I basically took over his client load just like that. And tried to switch as many people towards Tui Na as possible. So I still get to combine Tui Na and acupuncture. I like to do that, but I work at a physiotherapy clinic, so it's a nuts and bolts place if you look at it that way. So I don't necessarily allow my clients to understand that Tui Na and acupuncture can treat more than it can. So they'll just think of it as bad back, bad neck. So I should put more time and effort into that. But just haven't. Not a strong point.
Yeah, you've told me that on a number of occasions that the approach to business is something that.
Yeah, it's not my thing. I can think of. I'm good at promoting the medicine, and I just haven't done that properly where I work. I'll frame it that way. So I should do that.
Speaking of promoting the medicine, there's a book, I believe.
Yes, there is.
In the making?
Yep.
Yeah.
Nearly made.
Yeah.
After just a couple of months of... I think I've driven Martin insane for 8 years.
It's been 10.
Is it 10?
It's 10.
Really?
8 was making me feel better.
Okay. Well, I can round it down. I'm fine with that. We'll go for the next even number. It's been a long haul, close to a decade.
And Martin's done absolutely amazing work on it.
Yes.
He's the one that's put most of the work in. I just sort of, I don't know, which part of I to do with. It's based on all the things I've learnt and Martin's learnt as we've gone along on this journey and started with. The Tui Na I learnt, integrating it with trigger point therapy, Tui Na, which is abdominal massage, and I didn't learn that as a thing. I mean, literally, I was given a book by a patient who said, "You should read this because you've been doing my stomach and it feels better."
Was it by Mantak Chia?
Yeah, that's the one.
And she handed me the book, and I was already poking around, finding that the gut was a great area for reducing headaches, and that a lot of people's back pain came from there. You could do their backs every week, but once you started doing that, they were getting longer and longer, and I realised that there's these influences. And I used to look at, it's in that muscle, and then one day found out that they weren't. They were in the bowel, or they were in the viscera somewhere. And some of them weren't on the map. So it was more integrating that idea that the body's constantly got methods to deal with its illness. And those methods, once explored, whether they're inflammatory points or whether it's twisting muscles to try and take pressure off a disc, or... And that there's other feedback that your stress model, that your reaction to the world has an influence over your posture and how your gut works. Now that and then I started becoming really, really interested in gut-brain relationship stuff by Michael Gershon. So I read his book, The Second Brain, and then there was stuff that I saw in Sri Lanka, and Martin was looking into the same things, and it didn't add up that it was all just bacteria. That's a massively important part, what you eat. Yeah. But as one naturopath actually said to me, if it was so easy, we'd just eat the same food and we'd all be well. But there's this big area where there's this relationship between the way we think and the way we react, and things that were built in. So we started, I guess the approach I started teaching was integrative. I started showing them stuff that wasn't, that's Tui Na. We only teach you Tui Na.
It was never strictly Tui Na.
Yeah, okay.
I would add everything I could find, fill their heads with enough stuff that they'd go out and explore the world and come back and tell me. And as Don said to me once, Joe, you cure nothing. So thank you, patient, for making you look good. So my students have done the same for me. They've gone out and been successful. It makes me look good, So I just taught them everything I had in my head that day, as much as I could. Yeah. So, and I'm still learning, and I'm still confused about things, but it gives you an approach to a person to not just go, right, this is what I used last time. There's always a twist. Yes. We were going to call it Tui Na with a twist.
With a twist. Not a catchy title. So trying to get more business-like. We should probably come up with a better title.
Yeah, so an integrative approach to Tui Na was what we came up with. So it's just looking at it that it's not what you'd see in the schools. Yeah. It's way past that, and mixed with a whole bunch of things.
Yeah, and to try and encourage people to just be open.
Yeah.
to keep an open mind about things. I mean, clients will bring in conditions that won't necessarily be explained by what you get taught in school. And if you're not encouraged to be flexible in your approach, then you're kind of screwed.
Yeah.
So if you don't learn to bounce around and think of things and then think of the not obvious things, then that's one of the skills I think you really kind of need as a practitioner. I mean, one of the things Ivan taught us was, and I've had clients that have come in, well, I've been to see a chiropractor, osteopath, physiotherapy, and none of this has worked. It's like, well, you can take two approaches. One is they've missed the obvious, or they've actually gone and tried to treat the obvious, in which case your only option is to look for the stuff that's not obvious anymore.
Yeah.
So how do you do that? Now, that stuff's really hard to get on paper. That stuff's really hard to teach within a course and to have it codified and to tick all the boxes and sign that off and here are your learning outcomes. Well, how do you influence or teach people to keep their minds open and be flexible? So we've tried to pepper things with as many with different case studies or just different little anecdotes.
Yeah, good.
Just to say, hey, this has happened.
Yeah.
You should think of this.
Yeah, I think I think it has to be the way to move forward, to have an integrated approach to anything. Because if you're only ever looking at something from one side, then that's all you can ever expect to have.
It limits.
Yeah.
It limits outcomes, but also limits growth.
Yes.
You end up having that tradition, what they call the traditional approach, and tradition by definition means nothing changes. So we took the word traditional off everything.
Yeah.
Because it's not a traditional. I cannot in any way say that if I went and taught this in China, they'd look at me nicely.
Yeah, yeah.
But I'm pretty sure they wouldn't be unhappy with what we've done, because at no time we've thrown out anything they've done. In fact, explored deeper into what they were trying as they developed it.
Yeah.
What they were trying to treat and how they were treating and the people they were treating at the time and what they were influenced by.
Yeah.
And it's been around a long time, so it's not going away.
Yeah.
It's just not being exposed enough.
Yeah. It's just on the note of, like you said, the definition of tradition is that it doesn't change. I taught a CPD course in May, and one of the whole points was to look at acupuncture in a modern and integrative approach, hence the name. And one of the things I said was that the very ethos of traditional Chinese medicine or Chinese medicine is that stagnation leads to disease. And if all you're doing is using the same format all the time, then aren't you doing the very thing that you're trying to... Yeah,
the thing you're trying to avoid, you create.
Yeah.
And we like to think we're doing something traditional when we're studying, or people say, I do traditional Chinese medicine. It's like, well, what you're doing is only about 70 years old.
Yeah.
Yeah. It's a new tradition, not an old one.
Yeah.
It's funny.
And then you go and take the history of Chinese medicine and go, it's done nothing but change.
Absolutely.
So...
Well, we only had the manufactured needle since the 70s. So to say that it's the same as what it was is not accurate.
And Tui Na came and went and
Yeah.
was banned at one point, but only amongst the wealthy, because you weren't allowed to look at the skin. And,
Is that where using the towel comes from?
Yeah, and not just that, you weren't allowed to expose the belly or the back.
Yeah.
So you had to go through the clothes.
Yes.
So, but it was a medicine that was used well with the poor. Who it was more amongst the elite that you didn't do these things, or more acceptable.
Yes.
But it stayed alive down in the lower classes, if you want to call it that, where it was a medicine that your grandmother could do, your grandfather did, and passed on. And I also think it's where a lot of the touch stuff came with pulsing, and because you didn't have to go and poke the tummy. But with Tui Na, you could do it through clothes. So the little towel was the same thing, just that little separation in touch. And I got to say, when I was doing sports with oils, I had a reasonably good business.
Yeah.
But when I started doing Tui Na through clothes, I tripled it because
Really?
I could treat people who did not have to get undressed.
Yeah.
From cultures, little old Greek ladies who I could treat, and they didn't have to worry about anything.
Yeah.
Except taking their shoes off.
Yep.
And it was a better model, made people feel more comfortable, that there was not a lot of exposure necessary. So I think the Tui Na helped me huge amounts on that level, because I got access to people that would have thought about it very differently.
Yes. Yep.
And massage had massage because get undressed and don't like oil, or it's got connotations. Tui Na took all that away. And my patients became my business. This one Chinese doctor said to us, if you worry about your business, you'll forget about your patient. If you only worry about your patient, they'll have a wallet. They'll happily share stuff with you.
Yeah.
And he said, so focus on getting them well. They'll go and sell you.
Yeah.
And that was my business model. Didn't have business cards for 15 years. I used to write them on Post-it notes. Got a business card, my name and phone number. It was my wife who, I think you need a business card.
Yeah.
Oh, okay, that'd be nice. So it's that approach to Tui Na has that extra approach to people, is that you can do these things and on a whole range. So I've got a massively whole range from children right through, and we tried to put that in there, but we left the kids ones out. It's just
too complex.
Another book?
It's got
Probably.
I haven't got that many years left.
I can't wait that long.
We'll just chuck it out and say to them, someone's written a better book somewhere else.
I still want to do it.
Oh, God, he would. We've got the work there, but that's not our work.
Okay.
But it's our information I've collected over the years, and pediatrics is massive.
Yeah.
It's a really big, complex. I mean, adults are complex enough, but pediatrics
the kids are a completely different system.
Yeah.
And I think, look, part of getting everything down on paper has been finding a way to get it on paper that it makes sense and it actually is. It's more aligned with how the two of us think and how we think it could be presented. And it's not presented in an extraordinarily different way. It's just a slightly different way.
Yeah.
So getting it to a point where you can look at it and read and go, I'm comfortable with that. That's taken a lot of time.
Yeah. Okay.
And both of us have had moments or extended periods where it's not been a priority, but it's always been simmering there in the back somewhere.
Yeah. Yeah.
Martin's been a good push. I tend to drift. Everyone knows that. Even in lectures. We'll go in a straight line. We'll just go twice around the world and then we'll come back there afterwards. And it's similar. But I'm really proud of the work he's done on it. And the book, it is really the best we can do with what's in our heads to present it to people in a way that most people could read it and learn from it straight away.
Yeah.
And we wrote it in a language that everyone could understand, not just the therapist.
Yeah.
But that's so that people who've done massage, or whether they've done Chinese medicine or not, can still get benefits from it. But people who've done acupuncture who want to do a bit of body work, there's something they can go to and go, right, I can do that.
Yeah.
And I understand that. And also motivate them to go off and learn these other things. Have a look into it and see what there's out there and available to help people today that still fits into the model.
Yeah, yeah. Do you go a lot into like both sides of the Western physiology and Chinese physiology, or?
Partly, yeah. We like to marry both.
Yep.
They're there.
Where possible.
Yeah.
I mean, you could write an entire book on the Chinese perspective on things and all that kind of stuff. I think it goes into a little more depth than just your basic Tui Na book on different body systems from the Chinese medicine perspective.
Yeah.
But like we haven't included aspects of anatomy and physiology in there because we'll assume that that's kind of implied knowledge, or they can get another book like Grey's Anatomy that'll explain it a lot better than we could. Yeah. Plus, getting illustrations done is kind of expensive.
Yes, just a little bit.
So there's some assumed knowledge, but we try and present stuff from both perspectives and blend it as well as possible where possible.
Yeah. Is there a release date, potentially, when it's done?
We're hoping by the end of July, aren't we?
No,
that's what we were hoping.
No, I
for.
was hoping for by the end of June.
Yeah, we're hoping soon.
This
like
year?
really soon.
Yeah, okay.
It's just a couple of things to be finished off. One more run through. We go through and just edit, check what we need to check. And there's a couple of drawings being done.
Yep.
And that should be it. Either the layout and bingo.
And then,
But that's, well, hopefully August, September.
Yeah.
Hopefully. But it's like the last 10% can be another 50% effort.
Yeah.
It's ridiculous.
Of course,
I didn't realise how much work. Had I known how much work was going to be involved.
Might have followed my view. Throw it all on a piece of paper and hope for the best. But it's looking good.
Yeah, David Harper was telling me about the process of writing his books, and it's just...
No, he's the smart one that's been able to get a publishing deal, and he doesn't need to deal with the editing and all that kind of stuff.
Yeah, but I'm just saying, like, just to even start a book and then, like, to put it all together and want to do that, it's like, it's an amazing effort.
Look, it's completely narcissistic. To a large extent it is. It's the best, dumbest decision or the dumbest, best decision.
Yeah.
I don't care how you want to think about it. It's a dumb thing to want to go and do. But I think a lot of people have the idea that they would like to go and do something like that.
Yeah.
Actually, getting it to happen is just a mountain of work. I had no freaking idea. And had I known, I probably still would have wanted to do it.
Yeah.
But, like, honestly, it's
lucky he's doing most of them.
oh my goodness me.
I'm just on the side, go to the left. That looks nice. I like that. It is amazing how much work's gone into it, but I will be glad when it's finished.
Me too.
One, I want to just look at it. And nice enough, I've got over 100 people who've just said, well, when it's there, just send me a little message. I'd love to read it. And I go, oh, that's nice. And about half my patients who have experienced it for years and just want to look in it. A couple, I swear, will go off and become, something they want to do.
Yeah.
Just from being treated. But yeah, it'd be nice to get it out there and see how people receive it. And hopefully they'll enjoy it and learn something.
When it's available, where can people find it?
On Amazon.
Amazon?
Yep.
Yeah. Ebook and they can get it.
Yeah,
it's a way of getting it printed in a hard copy.
Yeah, there'll be print-on-demand versions available as well. I'm kind of old school like that. I like to have a physical book. Yeah. I think Ivan would just prefer to have it as an ebook.
I'm both. I like books. Okay. So I'll get myself a hard copy and stick it up on the shelf.
Yeah. I'm looking forward to a signed copy.
Oh, yeah.
Yes, that'd be good.
We can do that.
Yeah. If that's all right.
How do you sign that ebook?
Digital signatures.
No, that'd be good. We'd look at one. Definitely.
We've thought about how to get this information out to people, so there is a website people can go to if they wish.
Yes, and that is?
That is integrative.tuina.com. That's all one word. Or if you just type in, I think it's tuinabook.com. It will redirect you there because that's a lot easier to remember.
Okay. And you've also got tuina.com.au?
Yes. Yep, sister site. And there'll be a Facebook page as well that people can basically come and ask questions or
we'll try and
do whatever
things on there.
So you can't really interact with a website that much, but with Facebook you can sort of do these things a little better. So that'll be there somewhere.
Yep, I'll put all of the websites and all of the links on this post for the podcast, so when it gets posted around in the TCM community, everyone can find you and figure out a way to get to you. And then when you so guys, thank you so much for coming on. It's been amazing.
No worries. Thank you.
Hope we'll do it again sometime.
Okay.
We can do that.
Yeah. Maybe after the book's released.
What's it?
That makes you good.
Well, I was just thinking about I'd like to get drunk after it's released.
Release it, come here, get drunk, do the podcast. Sound like a plan?
It'll be funny.
Sure.
We may regret it.
You might regret that.
Someone might regret it.
But we'll wait and see what happens. We'll release it into the world, and we'll sit back, and it might be tumbleweeds and crickets, and that's completely fine. We don't care.
I don't think so. I think it'll be...
Look, it'll be something else for people to be able to pick up.
Yeah.
It's just another approach, that's all.
Yeah.
Just something that's sitting there that, we're really passionate about over the years. I'm still doing it after nearly 27 years, so it's not going away.
Yeah. Well, it's like you said, if you just approach it like your patients, like same with your book, it's just your passion. It's whether, it will probably be, for that reason, it will probably be a big success.
Whatever that means.
Whatever it means.
Whatever success is going to be.
Yeah.
And that's okay.
Yeah. Cool.
Thanks for having us.
Thank you very much, guys.
Thank you.
Thank you.